So hi guys, mental health is the topic for today, and mental health is everybody's responsibility. There's no health without mental health. In this video, I'll be trying to answer the question, is mental health the next pandemic coming next? Hi guys, my name is Shola and I'm a registered mental health nurse working in the UK National Health Service. On this channel, what we aim to do is to merge the gap between nursing and finance. In the area of nursing, we'll be supporting student nurses, registered nurses through their journey. We'll be talking about things like revalidation, placement, and many more. In the area of finance, we'll be giving you a better understanding of your pay slip, your payroll, tax relief, tax rebates, and so on and so forth. So, in today's video, we are talking about mental health, a topic that is very important to me, very dear to my heart. So, over the years, we know that we've had the pandemic, we've had lockdowns, people have lost their jobs, house prices have increased, people are isolated, and there's been increase in suicide rate and many more. I've got a list in front of me where I've written things like stress, alcohol consumption, job loss, anger, worry, sadness, isolation, lockdown, COVID, suicide, and many more. So in this video, what I want to address is that I want to actually become personal and actually talk about how the pandemic has affected me, or how the lockdown has affected me. Personally, in my line of duty, I look after people with mental illness, and I would say that since the lockdown, I used to be a very outgoing, social person. Now, I prefer to be at home. I became an introvert instead of an extrovert. I'd go to the shop and actually be very curious or conscious when people are moving too close to me. And I believe you can also relate to that. So leave a comment in the comment section below. Tell me how the pandemic has affected you personally. With regards to my clientele or my client group, these are individuals with depression, anxiety, bipolar disorder, schizophrenia, and many more. How has the pandemic affected them? I remember at the beginning of the pandemic, there was an increase in hospital admissions for people with mental illness, and that was because of the isolation. Some of these individuals probably don't have a phone, they don't have a television at home, and they would probably spend their time either in the park, on the bus, and I believe the lockdown restricted this from happening. Obviously, you and I couldn't leave our houses, and the same thing applies to them. So again, when you look at the homeless community, they often spend their time on the street. There's a limitation to how much time they can spend on the street, and this led to an increase in hospital admissions. We were having people having breakdowns, people were sort of going through hard times, hardship, financial difficulties, and there was so much issues going on. So what can we do to support these people, and how do we ensure that mental health is not the next pandemic? Because when you look at what's going on now, the house, apart from house prices increasing, cost of day-to-day commodities have increased as well. When you go to the shops, you're paying more. And for people who are with mental health, who have issues with financial difficulties, some who are homeless, you can see how this could be a problem in the next few years if we don't take things too serious. So what do we need to do? We need to provide people with mental illness more financial support. I remember when the pandemic began, in my line of duty, they actually allowed people or patients to use the cost of their care, which we say, with PHP, they allowed them to use their personal health budget to buy things like phone, to buy things like iPads, because before, those were not things that were allowed. But they actually realized that in order for us to be holistic, person-centered, we have to actually broaden our horizons, and at this time, people were actually using a PHP budget to buy things like TV, to buy things like telephone, and to buy things like iPad. So I believe strong financial support is required for individuals who are suffering from mental illness. Another thing is that there's going to be a lot of pressure on services, because we need people we're going to see people who are going to require more therapy, things like talk therapy, CBT and DBT, and many more. So leave it in the comment section below. What do you think can be done to ensure that mental health is not the next pandemic? And remember, mental illness is everybody's responsibility. Again, if today's your first time of seeing me on this channel, my name is Shola. I'm a registered mental health nurse working in the UK National Health Service. So please support me by liking, sharing, and leaving a comment on this channel. Thanks a lot for your time. Thank you.